Today I'm Ahmad and Gary will present an executive summary about an article entitled Domestic Violence Management in Malaysia, a survey on the primary healthcare provider. So without further ado, let's go into the background information of this executive summary. List of social, economic, religious and cultural value. This domestic violence is a major social and medical problem that happens in every country in this world. It is worrying to see the impact of this domestic violence. Briefly, the impact that we can see in this domestic violence are the death and the morbidity. Moreover, this domestic violence usually solved during pregnancy and it causes serious danger to both mother and babies. In addition, this domestic violence also affects the children of victims as these children might be trapped in between of their fighting parents. Not only that, most of the victims of this domestic violence like to keep their experience as secret, which have been proven by many studies. Those victims who need or seek help most likely keep or reveal this experience to the people that they are close. Contractually, time limitation, not enough practice, do not know how to respond, and perception toward patient non-compliance are the main issues that have impacted the response of this medical practitioner toward the domestic violence issue. As an example, a study in the emergency department in Hong Kong showed that most of the doctors realized that it was hard to manage this domestic violence victim optimally or properly due to their belief that it was the crucial of keeping the unity of family and domestic violence are private issues. The aim or the purpose of why this study was conducted is to gain or acquire the information of these primary healthcare providers' attitude, practice and knowledge regarding the identification and management of domestic violence to further progress intervention program that we had improve the general management of domestic violence.
Okay, thank you, Daniel, for your explanation on the background information and purpose of the article. And now I would like to talk about the research methodology of the surveyor. The survey was made for all the health providers of several clinics in University Malaya Medical Center, and the respondents were 108 healthcare providers out of 180 people who were working at the time of the survey conducted. The questions heavily focused on the clinicians and nursing staff's identification and management of domestic violence among their patients, with slight variation from one group to the other. With that out of the way, we would like to talk about the findings from the research. It was found that identification of abuse was possible because clinicians had directly asked their patient. Half of the clinicians responded that they would ask more frequently if the patient came with physical injuries in comparison to only minor injuries. However, due to the lack of time with patients, worries of offending them, and uncertainty of the correct procedures, it has been a slight obstacle towards identifying domestic abuse among patients. It is also weird that the clinician will be more concerned with risky behavior, such as smoking, alcohol, and sexual addiction, rather than any kind of abuse when they are meeting their patients. However, it is good that they would be selfless in asking patients about domestic abuse for their safety, with few respondents showing concern that doing so will only increase the amount of abuse. Sadly, there are still people who will blame the victim, with 51.1% nursing staff and 28% clinicians responded that the victim instigated the abuse upon them. Most of the respondents will also keep their silence even if they found out that there are victims of domestic abuse among their patients. This goes to show that most clinicians, with 98.4% response, have only moderate to no strategy at all to help the abuse, and also have no strategy at all in handling abusers, making them inefficient in managing domestic abuse. In regards to the efficacy of healthcare providers in managing domestic abuse, not even a third of the respondents were aware of any written procedures, while less than half can suggest an NGO that helps victims of domestic abuse, and minimal amount of them had attended an educational program regarding domestic violence. Thus, it is only logical that almost all of them believes that a social worker will help them manage patients better in identifying and managing victims of domestic abuse. And now, I would like to hand it over to Daniel for the part of the presentation of limitation on the research that was conducted.
The limitation of this study that can be seen is mostly on the where this study was conducted, because this study is a single study that conducted in University Malaya Medical Center, which located in suburban area. Therefore, the finding or the result of this study may not be applicable or represent other medical facilities such as the mental health setting or smaller primary care setting outside for non-urban area. Then the bias may be occur in response and recall because this survey was based on the self-reporting by the participant. Then the nursing staff may have low response rate, which is 45%, because they are hard to be contacted. This is because their working shift time, and also they may have lack research culture.
Thank you so much, Daniel. And now, I would like to talk about the conclusion and recommendation that we have gathered. As a conclusion, we found that the primary healthcare providers are inclined to see domestic violence negatively. However, good news this is, they are still managing domestic violence among the patients unprofessionally. This is due to the limited skill and training that they have, the inadequate amount of knowledge that they know, and negative personal values that they have evolved, which subsequently affected the identification and management of domestic violence among the patients. As such, there are several recommendations that we would like to bring forth to the table, which is first off is to stop victim blaming. This value is not only demeaning but also empowering the abusers that their action is justified in the eyes of society. Secondly, women doesn't mind if you ask them regarding the domestic abuse, because if they are a victim, they will appreciate that someone out there is looking out for them. Moreover, a safe environment in which a private consultation with the patient in absence of their partners is heavily recommended, as it gives them more room to breathe. Regarding the self-efficacy, it is recommended that the healthcare providers to be more direct in asking patients regarding abuse, as they are with any other kind of illness and addictions. Furthermore, healthcare providers should support victims at all times, as their self-esteem and image may be lowered by the abuser. Lastly, we recommend that healthcare providers attain enabling factors such as social workers and proper training, as they may think that they are not vital in managing domestic violence. And as such, we would like to end our presentation of our executive summary on domestic violence reports in Malaysia. That is all from us. Have a good day and bye-bye.